Hi, thanks for joining me at Student Nurses Success. We're going to cover the disorders of the male reproductive system in this video. Remember, you can find a link to the maps in the comments section. Let's first begin by just talking about some reproductive disorders. Hypogonadism is testicular failure, or it can be caused from a lack of LH or FSH from the anterior pituitary. What happens is it leads to a low sperm count and low androgens. So men with hypogonadisms usually have some changes in their secondary sex characteristics. The decrease in the testosterone increases the risk of cardiovascular disease, osteoporosis. It causes the loss of lean muscle tone and mass, and it leads to erectile dysfunction. Treatment for hypogonadism includes replacement of testosterone and monitoring for prostate cancer since it is a risk factor. Erectile dysfunction is the inability to achieve an erection. It can be primary, meaning it's been lifelong, they've never been able to achieve an erection, or it can be secondary. It's developed over time and it's usually related to one of the following disease processes: peripheral artery disease or atherosclerosis, which leads to a decreased blood supply to the reproductive organs. Those with diabetes or other pituitary dysfunctions or endocrine dysfunctions may also be at increased risk for developing erectile dysfunction. Medications, such as those taken for high blood pressure and antidepressants, also are implicated in development of secondary erectile dysfunction. Trauma can be a cause, as well as surgeries. Um, Radical pelvic surgeries are an iatrogenic cause. And it can also be caused by psychological issues as well. Now, men often remain fertile into advanced age. However, the aging male endocrine system does lose testosterone, and that testosterone does start to decrease after the age of 30. And this leads to atherogenic effects, increasing risk of cardiovascular disease. Also, as men age, the prostate does enlarge, and we will talk about benign prostatic hypertrophy, or BPH, later in the video. Erectile dysfunction becomes more common as men age, and also concerns related to loss of self-esteem and psychological concerns. Infertility is defined as the inability to achieve after 1 year of unprotected intercourse. This is the same definition for women. It can be idiopathic, related to hypogonadism, related to testicular atrophy, or obstruction of the ducts, which will limit the amount of sperm that is ejaculated. Let's talk about disorders of the penis. The first two are phimosis and paraphimosis. Both of these occur in uncircumcised men. Phimosis is when the uncircumcised foreskin cannot be retracted over the glands of the penis or the end. It can be caused by chronic inflammation, infection, calculi, or even the development of some types of squamous cell cancers in that area. It may also be associated with blantis, which is chronic or acute inflammation of the glans penis. Now, paraphimosis is when the foreskin that has been retracted is not able to be replaced back over, and swelling will start to occur. We see this with the insertion of a Foley catheter. When you have to retract the foreskin, make sure that you pull it back over and don't leave it retracted. In both cases, phimosis and paraphimosis are treated with circumcision. Urethral structures are the narrowing of the urethra, and it's often due to the development of scar tissue from infections, most commonly STIs, or it can be from trauma. Manifestations are going to be decreased urinary stream, urinary retention, hesitancy, development of urinary tract infections, and possibly urethral discharge. Priapism is a painful, persistent erection. It can be idiopathic or due to a secondary cause, such as sickle cell anemia, diabetes. Medications, such as those for high blood pressure and depression and anticoagulants, can also cause priapism. Priapism is an emergency. It does need to be treated. They may treat it with cold packs, maybe analgesias or sedatives. They might aspirate blood or use alpha adrenergic agents. Peyronie's disease is inflammation that results in progressive fibrosis of the penis that causes an upward bowing of the shaft during erection. It is often associated with erectile dysfunction. Let's move to disorders of the scrotum and the testes. Hydrocele is a collection of fluid around the testicle or spermatic cord. It can be congenital or it can be secondary, related to injury, infection, or even a neoplasm in that area. Manifestations are going to include scrotal swelling, and that swelling is going to increase as the day goes on. It'll be less in the morning and more as the day goes on. Now, spermatocele is a collection of sperm, a cystic mass that develops in that same area. It's idiopathic. We're not certain why it happens. It is difficult to distinguish the difference between a hydrocele or a spermatocele. Testicular torsion is an emergent condition. It's twisting of the spermatic cord and it compromises the vascular supply, leading to ischemia and necrosis of the testicle. Patients present with sudden severe pain and swelling, and it does need to be managed emergently in order to save the testicle. Epididymitis and orchitis are inflammation of the epididymis or testes. That's usually from an infection, often from STI, but it can also be from E. coli. It could also be related to trauma. Manifestations will include an enlarged red, tender scrotum, pain, elevated white count, possible discharge, and fever. Testicular cancer peaks in late adolescence or early adulthood. Early detection can be obtained with testicular self-exam. There is some association between cryptorchidism and testicular cancer. Cryptorchidism, we're going to talk about in a moment under the congenital disorders. I'd like to cover two congenital disorders. Both of these would be present at birth. Hypospadias or epispadias. In either a hypospadias or an epispadias, there's an abnormal location of the urethral meatus. A hypospadias means that the urethral meatus is on the underside or ventral side of the penis, where an epispadias means it's on the top or dorsal side of the penis. The problem with this is it is going to alter the urinary stream. It can increase risk of UTI, and it can alter fertility down the road. So we do surgical correction of this when the child is anywhere from maybe 6 to 18 months of age. If the baby is born with a hypospadias or an epispadias, they will not circumcise that baby because they may need to use that foreskin for some of the repair. Cryptorchidism is undescended or hidden testicles. So when the baby is born, if they're not able to palpate those testicles in the scrotal sac, they'll go ahead and see if they're still up in the abdominal cavity. If they leave them up in the abdominal cavity, it can alter the development of sperm and fertility lifelong. So usually what they'll do is they'll treat it with HCG, which may help those testicles drop down into the scrotum, or they'll do surgery, an orchiopexy, in order to pull them down. Even with correction, there can be alteration in fertility down the road. Let's finish up with the prostate. The prostate gland surrounds the urethra. In this picture here on the right, this is an enlarged prostate. You can see the enlargement, and the enlargement actually presses and decreases flow coming out of that urethra. So in this picture, that prostate is very enlarged. It's normally not that big. There are three main issues with the prostate: prostatitis, benign prostatic hypertrophy, or prostate cancer. Prostatitis is inflammation of the prostate. It can be bacterial, E. coli is a common cause, or it can be non-bacterial. With prostatitis, patients generally have fever, chills, back pain. Because it's pressing on the urethra, you're going to have frequency, urgency, dysuria. But what's key about prostatitis is the prostate is usually very tender and swollen. So prostatitis, we see more of the fever, the back pain, and the tender swollen prostate along with the other symptoms. Now, benign prostatic hyperplasia or hypertrophy is a non-cancerous, it's benign enlargement of the prostate, and it's from the decreasing of testosterone. It's very common in men over the age of 60. In fact, most men over the age of 60 have some degree of prostate enlargement. As testosterone decreases, we know that it does increase cardiovascular risk. And we also know that those with diabetes, cardiovascular disease, and genetics, those are all risk factors for the development of an enlarged prostate. Manifestations are going to be related to urinary flow, nocturia, or the need to get up in the middle of the night to urinate, dribbling, weak stream, maybe stasis of urine up into the bladder where they may develop urinary tract infections. Now, prostate cancer is often very slow in growing in older men, and it may even be asymptomatic. However, in younger men who are maybe in their late 40s or 50s, early 60s, it's much more aggressive. In older men who develop prostate cancer, maybe in their 70s or 80s, they actually may not even treat it. It may be so slow growing that it's not treated. We know that genetics does increase the risk of prostate cancer. Manifestations of prostate cancer are the same of BPH. So you'll have all the symptoms of decreased urinary stream. In addition, the prostate will be fixed, nodular on exam. There may be hematuria or blood in the urine, and you will see a rising PSA level. So if the PSA level increases, we know that the prostate is growing and that actually we should look into prostate cancer at that time. It's important for men to get regular PSA levels drawn as they get older. And that should cover our disorders of the male reproductive system.